Hello, bonjour, Alberta. Did you know that at least 238,000 people speak Français in Alberta? And those numbers just keep on growing? Oui, oui, c'est vrai, it's true. And thanks to Shaw TV Community Access Programming, we get to reach out to everyone to let you know all about special people, places, events, and activities happening right here in this great province, in both English and en français. That's right, mes amis. We begin the first part of our program in English, and then we repeat it en français. So stay with us. Restez à l'écoute.
Welcome et bienvenue to Hello Bonjour Alberta. I'm Marc Lalonde.
And I'm Anne Boiteau.
In this episode, we have a very interesting new healthcare concept being launched in Calgary to talk to you about. And to that end, we have Susan Stratford, who is the manager of La Clinique Francophone, and Jonathan Perron-Clow, who is coordinator of the French Services Incubator here in Calgary, and we'll find out more about that. Welcome to you both.
Thank you.
Let's start by finding out a bit about your background. Start with you, Susan. Where are you from, and how did you come to be manager of the new Clinique Francophone?
I'm actually from Winnipeg, and I still live in Winnipeg. So I come out to Calgary twice a month to support them in just the starting of the clinic. When I was in Winnipeg, I was the executive director of a clinic that was very similar to the vision of the La Clinique Francophone ici. It was also a community center and clinic within for the Francophone community of Winnipeg. So when Jonathan and some of his colleagues came to Winnipeg and did a tour, we had a chance to meet. I had just decided to take early retirement, and so it just sort of worked out that I could help them out for a bit of time just to get started with the clinic here.
So what is your background? Have you lived in Winnipeg all your life then?
I have, other than a couple of years going to school. I went to McGill to pursue speech pathology. So that's my clinical background.
Oh, okay.
But I've been in health administration for many a year. So,
many years, okay.
Yeah.
Making the system work over there. And then
hard.
we'll see.
Trying hard.
Yeah, now you've got the challenges of healthcare in Alberta to look after. I hear there's an opening, Alberta Healthcare President or whatever, for some other time.
Exactly.
Thanks, Susan. Hey, Jonathan, what's your background?
So I'm from Ottawa originally. I grew up there for first a bunch of years of my life, and then my fiance got a job here at the University of Calgary, and so, you know, when you're in love, you you follow the person you love, and so I came out here 2 years ago, and started working at La CFA just after that, and have been working really on this since November 2013.
I like to see that. The man following the woman. It's usually the opposite.
You would,
eh?
yes.
So, Jonathan, what's your background?
So my background is actually in political science. I have a master's from Carleton University. And a lot of people say, well, you know, health isn't political.
But it's a science.
It's a science,
political.
but I would say that it is political, and a lot of my fun is actually working with different government agencies and some of the politicians as well on moving this forward. So I get my political fix working there for sure.
And so describe to us what La Clinique Francophone is.
It's a clinic that's very similar to what you would find in your doctor's office, a family practitioner office. So our vision is to offer a whole range of primary care services for the Francophone population of Calgary and the surrounding communities. Right now we have a nurse practitioner who is working with us on a part-time basis, which is a bit of a, it's not necessarily a new model, but it's not necessarily as well
Established
well established here in Calgary. But Marie works with us on a part-time basis as the nurse practitioner, and she offers a full range of services very similar to what a family physician can offer our patients. We are also hoping to recruit a physician or a couple of physicians down the road to work with us and have that whole team approach. That's one of the real strong values of what the Clinique Francophone would like to establish, is to work as an interdisciplinary team so that we can really feed on each other's strengths. So to that end, we've also brought on a psychotherapist who is available to provide service to clients already. She works with us on a contract basis. Now that service isn't covered under the public health service with Alberta Health at this point in time, so people do have to have either insurance coverage or pay for that service themselves. But we're really pleased that she's also joined the team. And Jonathan and folks at ACFA have done a lot of work creating a network of individuals who speak French, various professionals. So if someone needs another service that we don't have at the clinic, we very much want to create that referral service and create a network and partnerships that provide whatever people need, right? And that's really the key, is to get the service to the people when they need it, right? So we want to be a good primary care service in that regard.
Okay, so it's a health center.
It's absolutely a health center.
Almost belong to, I guess.
Very
much
similar.
like a doctor's office.
Absolutely. Yeah. So you have that continuity of care. When you're healthy, you might get an annual checkup, but you also then may come back if you've got the flu or any other challenge, or if you need a referral. Medications, our nurse practitioner can prescribe medications. There's no issue with that. So the whole range of services.
Well, let's come back to the Francophone aspect of that in a few moments, but I'd like to ask Jonathan about the history of this. This is obviously quite some time in the making, and what's the role of the Association Canadienne-Française de l'Alberta in Calgary and the incubator? How did this all come to be? When did it start?
Well, I was reminded recently of really the whole history going back to the 1870s, ever since Francophones have been here, and Dr. Rouleau and the opening of Holy Cross Hospital. So there's been a French health service available. It stopped for a while. Now, 2015, we're starting it over again. But it's been a number of years now that both the ACFA and the community have been very closely involved in getting this started again. So in the 1990s, they had the health referral system at the ACFA, trying to understand who are the health professionals that speak French in Calgary and can take people in. We've done that again now. But on top of that, we knew that there was needs in the community. It came really from the schools, the Francophone schools, where a lot of the people working in the schools were having a difficult time helping families because they had health needs that they couldn't be served, or they were having a tough time finding services in French that they could understand. And so they created a committee that was kind of, the ACFA did the kind of administrative work for, and I was hired in 2013. The committee had already been existing, but I was hired to do that type of admin, gather all the information, gather all the needs of the community, both from this volunteer committee that represents all sectors of Francophones in the city, and then as well as the needs expressed by Francophones in the area. And together we were able to put together a funding request to Health Canada that was accepted, and so now we're being funded.
Pilot project now.
Right, a pilot project. So it's a 3-year funding package, and there's also support from the Francophone Secretariat of the Ministry of Culture of Alberta, as well as the Community Initiatives Program of the Ministry of Culture. So there is support from both the federal and the provincial government, and as we move along, we're looking also for support from Alberta Health Services.
And when was the clinic opened? When did it first open?
6 weeks ago. May 1st was our official opening, and then May 4th was the first day that Maurice saw patients. So,
okay.
yeah.
And you have how many patients to date?
We have about 300 people that have expressed an interest to start to come to the clinic as our provider in 6 weeks.
That's amazing.
Yeah, and we've already scheduled almost 200. Either we've seen or they've already been scheduled. So, and we've started a waiting list because you know, one person who works part-time isn't quite able to meet that full demand yet.
Yes.
And that's why we're really looking to see if we can find some other
And of course,
folks
from
to
a
work with
funding
us.
point of view, it's a bit of a challenge because nurse practitioners aren't covered under Alberta
That's
Health
right.
Services yet.
That's right. And that's really the source why we needed the other dollars to try and augment sort of some of those costs, including the rent of the clinic and whatnot. Yeah.
So talk to us a bit about why it's important to be served in your native language for health services.
It's essential, and for someone who speaks English as a first language, it's not always evident, right? It wasn't until I really started working closely with the Francophone community that I started to get it, right, as to why it was important. But when you're sick, or when you're really feeling vulnerable, it's just not always easy to express yourself, and you're scared, and it's really difficult. And so to have that ability to express yourself in your first language is super important. And there's been a lot of research actually that demonstrates that for folks who aren't served, where there's that communication mismatch around language, that the costs actually go up. Because you have to do more tests. You have to verify information. People can't express themselves as clearly, or may choose a word that they think is the right translation, but isn't quite, right? Yeah. And certainly as someone who has learned French as a second language, I know there's lots of those, right? Where I think it's the right word, but it really isn't, and it can mean something quite different. Mm-hmm. So it's really important, and there's been lots of research that's demonstrated the importance of that, particularly with young folks and our elderly population and those in crisis. Those are sort of some of the key populations that really, really are vulnerable to having that mismatch of communication.
And do you serve only in French? Your services are only provided in French?
All our providers are bilingual, so they are able to provide service in English or French. Our mandate is to serve the Francophone population of Calgary and the surrounding communities, but we also believe in continuity for a family. So if there is a family where one of the parents, for example, speaks French and the other is an Anglophone, we're willing to serve all of those folks if they live sort of in the same household, because we do see the need for that continuity of care from a family perspective, and that's a value that the clinic holds.
That's a very good point.
Yeah, but we do want to make sure that because it was created by the Francophone community for the Francophone community, that we respect that in terms of the service. But we also know that sometimes people are educated in English or work in an English environment, and they may want to use an English word here or there. That's obviously no issue, right? Because our folks are bilingual.
So if people want to access the services or get involved in some way, you have your website?
We do have the website. Yeah.
And the phone number, which is on the screen here.
Excellent. Yeah. Okay. And they can contact us. Jonathan is probably a little more available than I am, but and for folks that would like to become part of our patient group, certainly we have I'm struggling for the word in English, isn't that funny? But we have a form that people can fill out and indicate that they would like to become a patient. Yeah.
Great.
Yes, and other than Marie and Jonathan, anybody else working at the clinic?
We have a medical assistant as well, so who receives all the calls, right? The front person books all the appointments and whatnot. So Mona is her name, and so we're pleased to have her.
We're out of time for the English segment, so I want to thank you both, Susan Stratford of La Clinique Francophone, and Jonathan Perron-Clow of l'ACFA, la CFA. Stay with us, please. We continue en français.